At Salem Health, volunteers have always made a huge difference to our patients and staff, and we could not do it without them. In the late 1800s, at Salem's Deacon Hospital, Sister Anna Dirksen volunteered with no salary for 20 hours a week. History says she carried patients up 3 flights of steps to their hospital bed when the hospital was still in a hotel. She physically carried and emotionally cared for patients as our first known hospital volunteer. From the early days at Salem Deacon's Hospital to today, the spirit of volunteerism is alive and growing. Salem Health now boasts over 300 volunteers, helping with everything from cuddling babies, to moving visitors around campus, to sitting with patients who are afraid and alone. Salem Health volunteers continue to inspire staff and patients as they serve throughout the organization, meeting the needs of our patients, staff, and providers in 2 hospitals, 4 clinics, and in over 50 different roles. A hospital journey can be intimidating and scary for patients and family. Volunteers understand. They help patients to find calm and confidence in the care they will receive. Volunteers are there to greet and welcome patients and to put them at ease and reassure them. In some cases, patients need services to get to the hospital. The Connections Drive program helps with our Polk County patients. Volunteers drive to homes, pick up patients, and bring them to their medical appointments, then happily return them home. Volunteers not only greet the patient, but also escort them to their next destination. No need for patients to worry about where they are going. Volunteers want patients to have the best of everything. In addition to staff, volunteers are there to support patients and ensure they are cozy. Patients deserve to know what is going on with their care, especially when things seem overwhelming. Volunteers answer questions and check in on patients. Volunteers ease their fears along the way, plus make their stay a bit more enjoyable. Volunteers like bringing a smile to patients in any number of ways. They never want to see the patient nervous or feeling lonely. Patients sport the latest in hospital gown attire. Volunteers are always making certain gown packets are perfect. They know patients need it. Volunteers know the staff are busy caring at the bedside. Volunteers visit with patients and complete other needed tasks to free up staff. Volunteers might be found doing office tasks, putting out mailers, creating patient information resources, or making phone calls. You name it, they are helping. Volunteers visit with patients when they are lonely. They provide reassurance, smiles, a joke or a warm blanket, and even food when needed. Whatever the patient needs, volunteers want to assist. As patients prepare to leave, volunteers are ready to help with a warm send-off. From Sister Anna to our ambassadors and Connections drivers today, volunteers are shining a light that inspires all at Salem Health and have been doing it for 125 years. We love them, the staff love them, and our patients love and rely on them. We can't thank our volunteers enough. Have you been thinking about volunteering? Come and be ready to inspire. Join our community of volunteers who care and shine. We look forward to the next 125 years.